Hello everyone, glad to see you here. In this class, we will talk about the general physical examination and the method of general condition and skin exam. We will also learn together the distribution of the lymphatic system, the palpation of lymph nodes, and its clinical significance. When we look at a patient, or a patient comes to visit you, or a patient was sent to you in the emergency center, where would you look at first? I believe the answer will be his or her face. It is correct, of course. The patient's face can tell us a lot of messages and information about his or her situation. And most of all, the first thing coming to our eyes is the skin of the face. That is why we must pay attention to the patient's skin. And what are the most important aspects when we examine the skin? The answer is the color, the moisture, the eruption, and the abnormal signs on the skin. Skin coloration results from a blend of pigments, which is different in each individual. But before we talk about the examination of the skin, we must first be aware that there are many diseases originally from the skin, and there are many more diseases which is not originally from the skin, but could affect the status of the skin. And the lesion could be local or systemic, according to the situation of the disease. So we can't determine or diagnose a disease just because we see the specific symptoms on the skin. The more important thing is to do a further body examination and find the correlations between the skin and the real disease. In a word, you should pay attention to the skin, but don't just look at the skin. First, let's talk about the color. There are several abnormal colors of the skin, which mainly are pallor, redness, cyanosis, stained yellow, pigmentation, vitiligo, leukoplakia, and albinismus. And the most commonly seen abnormal colors in clinical works are pallor, cyanosis, and stained yellow. These three abnormal colors are also the key points in today's lesson. Pallor is the lack of the normal red color imparted to the skin and membranes by the blood and the superficial vessels. Skin color is modified by the thickness of the avascular epidermis and the amount of melanin and other pigments in the dermis. Inspection for generalized pallor is always supplemented by observing the color of the conjunctive, the oral mucosa, and palmar creases. In deeply pigmented persons, this may be the only reliable physical signs. Pallor can be produced by edema surrounding the superficial blood vessels, vasoconstrictions, anemia, or any combination. In our daily clinical practice, pallor is mainly caused by the lack of blood, resulted from many types of disease. The clinical occurrence of cyanosis can be defined as local cyanosis and central cyanosis. Local cyanosis, localized venous status or arterial obstructions, renal phenomenon, or extravasations of blood in superficial tissues. Central cyanosis is usually caused by hypoxemia, which means the lack of oxygen, and results in the presence of abnormal hemoglobin pigments. Peripheral cyanosis implies normal arterial oxygen concentration, but increased oxygen extractions because of sluggish flow in the capillaries of the cutaneous vessels. Next, we will talk about a familiar symptom in clinic, especially in patients with liver disease or hemolysis, which is called jaundice. What does the word jaundice mean? Jaundice comes from the French word jaune, which means yellow. Yellow skin is also caused by carotene and rare chemical toxins, conditions that must be distinguished from jaundice. Although jaundice merely means yellow, medical use reserves the term for bilirubin staining. Bilirubin stains all tissues, but jaundice is most intensive in the face and trunk. Jaundice is usually visible when the concentration of conjugated bilirubin exceeds 30 mg per liter in serum. Jaundice is less visible in artificial light than daylight. When the jaundice is of long standing, the deep yellow may acquire a green hue. What's more, we must be aware that taking too much oranges or carrots could also cause jaundice, but the serum level of bilirubin is normal. That's the point to distinguish these two situations. Skin moisture always refers to the level of body liquids. Loss of adequate sebaceous and or sweat gland function lead to excessive drying of the skin. The skin is dry, often cracked and leathery in texture. Loss of extracellular fluid leads to increased viscosity of the interstitial space fluid. It should not be confused with a decrease in cutaneous elastic tissue. In evaluating for dehydration, check the lying, sitting, and standing blood pressure and pulse for postural changes. Check for loss of skin turgor. Pinch the skin over the back of the hand with the thumb and index finger and then release it. Normal turgid skin rapidly resumes its customary shape. Loss of turgor is indicated by persistence of the fold for a time after pinching. Meanwhile, the skin elasticity is closely related to the patient's age, condition of nutrition, the amount of body liquid, and the power of muscles under the skin. We usually test the elasticity of the skin under the forearm. Skin eruption is also a very important part of skin examination. It includes macules, macular papules, plaques, and so on. They all have their specific features and distinctions which needs further studies in the future. Intradermal hemorrhage is usually seen in patients with hematonesis. It includes ecchymosis, purpura, and hematoma. When this hemorrhage occurs on the skin, we should pay attention to do the blood test in order to determine whether the patient is suffering from disease of hematology. There is a very strange and special sign on the skin, which is called the arterial spider. The cause of an arterial spider is still unknown. We only know that it has some relationship with the disease of the liver. While the disease is developed, a coiled vessel arises from a deep artery, and its distal end forms the central body from which the legs radiate in the plane of the skin, branching and rebranching. When the body is pressed with a pencil tip, the radicals fade, and it is shown in the slide. They feel centrifugally when press is released. Spiders occur commonly on the face and neck and the shoulders. Next, we will talk about the lymphatic system. Lymphatic system is an essential part of the immune system and plays a very important role in the defense of the disease. The examination of the lymph node is very commonly seen in the detection of several kinds of disease. Enlarged nodes may be visible by inspection, especially with light. Examination is primarily by palpation. We can see in this picture that the main constituent parts of lymphatic systems are lymphatic vessels, lymphatic capillary, lymphatic trunks, and lymphatic nodes. And the following characteristics of palpable lymph nodes should be noted: number, size, consistency, mobility, tenderness, warmth, and whether they are discrete or matted together. Procedures for examining the major lymph nodes beds should be mastered by all of you. And please remember, all lymph nodes varying areas should be palpated when searching for generalized lymphadenopathy. Take the cervical lymph node area for example. On palpation of the cervical lymph nodes, seat the patient in a chair and stand behind the patient to palpate the neck with your fingertips. Examine in sequence. Pay especially attention to the various lymph node sites. Preauricular, which is slightly in front of the targus of the pinna. Postauricular, which is behind the pinna on the mastoid process. Suboccipital, which is in the midline under the occiput to either both sides. Submandibular, which is under the jaw near its angle. Submental, which is under the chin in the midline and on either side. Jugular, which is along the anterior border of the sternocleidomastoid. Posterior sternocleidomastoid, which is behind the posterior border of the upper half of the sternocleidomastoid. And the supraclavicular, which is behind the mid portion of the clavicle. The sequence of the examination is very important, and we must all remember, because the correct order makes sure that not lymph node region could be missing. And we should not forget to examine the both sides when we palpate the lymph nodes, and to do the comparison. When we touch the enlarged lymph nodes, remember to record the characteristics, as it is crucial for the diagnosis. More limited regional lymphadenopathy may be an early sign of a generalized disease, or might represent regional or local disease. There are 4 specific syndromes involved in regional lymphadenopathy, which are worthy of special consideration. Postauricular nodes, which refers to bacterial or hepatic infection of the acoustic metals. Preauricular nodes, many kinds of lymphoma or carcinoma or virus infection. Mandibular nodes refers to afferents from tongue, submaxillary gland, submental nodes, or mucosa of lips and mouth. Submental nodes refers to afferents from central lower lip, floor of mouth, tip of tongue, skin or cheek, and so on. Today's lesson is mainly about the physical examination of the skin and lymphatic system. For the skin, we use inspection usually, and for the lymph nodes, the palpation is the most commonly used function. Both the examinations are equally important for physical diagnosis, and the understanding of the relationship between the disease and the occurrence will help us to do them better in the future. That's all for today. Thank you for listening. Bye-bye.